Many medical students struggle with reading licensure exam style questions. They are long, include lots of information, and not only test whether you know the content, but also whether you can identify what is being asked, sort through details quickly, and choose the best answer under pressure. In this video, I'll show a simple strategy you can use to approach these questions more confidently. By the end of this video, you'll understand the anatomy of a licensure exam style question. You should also be able to identify the different parts, like what is the lead-in versus what is the stem, and you'll also be able to recognize what type of exam question you're looking at, such as recall, recall plus diagnosis, or diagnosis with next steps. I'll also talk about using the 3-pass method to break down the stem and help you sort out details before choosing the best answer. Licensure exam questions usually follow a predictable format. First, you get the clinical vignette, which gives you the patient story and clues. You then get the lead-in, which tells you exactly what task you need to perform in order to answer the question. Finally, you get the answer choices, which include one best answer and several distractors designed to test your reasoning. If you understand that structure, the question becomes much less overwhelming. A lot of students start reading from the top and try to hold every detail in their head at once. That can make long stems feel confusing. Starting with the lead-in helps you know what to look for before you read the stem. In this example, the question asks for most likely cause, so you already need to think about diagnosis and underlying pathology. Reading the lead-in first can also keep you from morphing the question or making assumptions. Most licensure-style questions fall into a few common patterns. A recall question asks for a direct fact. A diagnosis question asks you to interpret the vignette and identify what condition is happening. A next step question goes one step further and asks you what you should do in management or treatment. This example is a diagnosis style question because we are being asked the most likely cause of the patient's condition. A 3-pass method can help you break down everything that's in the stem. On the first pass, notice the patient is a 54-year-old man with crushing chest pain radiating to the left arm. That already points towards a cardiac issue. On the second pass, focus on the fact that the pain has lasted about an hour and that he is diaphoretic and anxious, which makes the presentation sound acute and serious. On the third pass, look at the history and objective findings. He has hypertension, hyperlipidemia, and a long smoking history, which are strong cardiovascular risk factors. The ECG shows ST segment elevations in leads 2 and 3 and an AVF, which strongly supports acute inferior myocardial infarction. Once you have worked through the vignette, compare the answer choices to the clinical picture. For example, plaque rupture fits best because it can cause an acute myocardial infarction in a patient with these risk factors and ECG findings. Instead of picking something that only seems plausible, find the answer that best explains all of the findings. To summarize, start with the lead-in so you know what the question is really asking. Identify the question type so you know how to think about it. Use a 3-pass method to read the vignette in a structured way. Then eliminate weak options and choose the best answer that fits the whole case. Using this process each time can help you stay focused and avoid getting lost in long question stems.